Hello, my name is Megan Ayers, and I am an indoor air quality expert from the Environmental Protection Agency. Today I've been asked to speak at the Pulaski County Town Hall meeting about how you can protect yourself and your family from radon exposure. Today we will discuss what radon is, who is affected, the health effects, how and when to test your home, the EPA standards for radon, current data for radon in Arkansas, and how you can protect your home. First, let's talk a little bit about what radon actually is. Radon is a naturally occurring gas that is colorless, odorless, and tasteless, and therefore undetectable to humans. Radon can be found in the soil, rock, and groundwater anywhere in the United States. The isotope in question, radon-222, is formed from the radioactive decay of uranium-238 into radium-226, which is found in our everyday soil. As radon begins to decay, many of the decay products are aerosolized into a gas. Once in the soil, radon gas has the potential to seep into the cracks of our houses where it can accumulate to dangerous levels, which we then inhale. Radon can be found in the air outside. The EPA estimates that the average outdoor radon concentration is 0.4 picocuries per liter of air, while the average indoor concentration is 1.3 picocuries per liter of air. Therefore, we see the most health risk from the accumulation of radon indoors where it is less diluted. The amount of radon that enters your home depends on the type of soil around your home, as well as the structure of your home. This can be due to pressure differences between the base of your home and the soil that can create a vacuum effect and pull radon gas into the home. The foundation of your home also plays a role. Many homes have normal cracks and pores in the foundation. This is a great way for radon to seep into your home, especially those with basements. Radon also has the potential to seep into the well water and enter your house through showers, sinks, and hoses. So who is actually affected by radon? Anyone has the potential to be exposed to radon gas anywhere at any time. It is important to remember that you can be exposed to radon in your home and your workplace. Since we spend most of our days at work, this will still contribute to your overall exposure time, even if your home tests within acceptable radon limits. Radon gas is heavier than air and is typically found in the highest concentrations at ground level. Those who have basements, have built a new home, or have recently undergone construction should be especially cautious. Radon is one of the most researched carcinogens. The health effects of radon exposure depend on the concentration of gas as well as the duration of exposure. Most of these effects are felt on the respiratory system of the human body. The highest dose of radon is experienced by the bronchial epithelium when toxic air passes through the lungs. However, the skin, kidneys, bone marrow, and other organs can be affected if radon is ingested through drinking water or bathing. There is no known threshold concentration at which radon does not pose a risk to human health. In fact, the majority of lung cancer cases attributed to radon exposure are due to exposure concentrations at the low to moderate levels. The health effects of radon exposure are not to be taken lightly. Radon is the #1 environmental cause of cancer in North America. It is the #1 leading cause of lung cancer among non-smokers and the #2 cause among all cases. Approximately 21,000 lung cancer deaths in the United States can be attributed to radon exposure each year, and 10% of total lung cancer cases annually. So when is the right time to test your home, and how can you do it? Since there are no clear signs of radon in your home, the only way to know is to test for it. There are 2 ways to test for radon. The first is short-term testing. This is conducted over 2 to 90 days and can measure the average radon exposure in your home during that period. Some examples of short-term testing include charcoal canisters and electron ion chamber tests. The second way is long-term testing. These tests are conducted over 90 days or more and can give you a more accurate year-round average, as radon levels can fluctuate over the months. Some examples of long-term testing include alpha track and electric detectors. The EPA has set specific standards for acceptable radon levels in the home to help determine if you need to make any changes in your home. The EPA has established 3 zones. Zone 3 is the lowest level and includes counties with predicted average indoor radon levels less than 2 picocuries per liter of air. Zone 2 includes counties with average indoor radon screening levels from 2 to 4 picocuries per liter of air. The most severe levels are found in Zone 1 and include counties with average indoor radon levels greater than 4 picocuries per liter of air. Homes in Zone 1 are advised to take further steps to mitigate their homes. While Pulaski County is a Zone 3 county, many counties on the northern border are Zone 2 counties, including Benton, Baxter, Boone, and Fulton County. While there are no counties in Arkansas in Zone 1, all levels of radon gas pose some risk, and residents should consider taking action to limit and reduce exposure. There are several mitigation techniques that you can follow to protect your family. Hire a state-certified radon mitigation contractor to come check and fix your home. Follow one of several radon reduction techniques. These can include sealing cracks in the foundation, using a fan to blow air in the lower levels of your home to create pressure changes that prevent radon from entering the home, or ventilate your home. Even with a radon reduction system in place, it is important to regularly test your home. To review, here are the main steps you should take to avoid overexposure to radon. First, test your home. If your level is greater than 4 picocuries per liter of air, then you should hire a certified mitigation contractor, regularly retest your home, and maintain the reduction system put in place by the contractor. If your levels are less than 4 picocuries per liter of air, then you should retest your home every 5 years. But consider some of the mitigation techniques previously discussed. For more information on radon in Arkansas, you can contact Bernard Bevel at the Arkansas Department of Health Radiation Control at bernard.bevel@arkansas.gov, or call the program's toll-free hotline at 1-800-462-0599.